Good afternoon, everyone. Today we recognize Minority Health Month as an important and necessary time to raise awareness about the health inequities that disproportionately impact communities of color. As the Council's lead for eliminating health disparities in public health, and as a longtime public health professional, I am fully committed to improving minority health outcomes. I am proud to be joined by leaders who have done so much to invest in the health and wellness of our minority communities. First off, we, the council, cannot do this work alone, so we appreciate having our county executive, Mark Elrich, here, key leaders from the Department of Health and Human Services, Montgomery County Health Officer, Dr. Keisha Davis, Deputy Health Officer, Dr. James Bridgers, and Acting Chief of Public Health Services, Dr. Christopher Rogers. Members of our county's 3 minority health improvement organizations, the African American Health Program, the Latino Health Initiative, and the Asian American Health Initiative. We are also joined by Anita Neal Powell, a community activist, advocate, researcher, historian, and public speaker whose career with the United States Department of Health and Human Services spanned 50 years. And finally, Judge Chung Pak, the Chief Administrative Law Judge of Maryland Office of Administrative Hearings, and Dr. Hyeon Suk Choi, President of the Korean American Association of the State of Maryland. Both of these leaders have done tremendous work raising awareness about minority health and wellness, particularly within the AAPI community. Thank you all for being here, and if you want to join me in a bit. Before I turn it over to our special guest to share remarks, I would like to speak briefly about this year's theme: better health through better understanding. Health literacy has become increasingly worse in our county, particularly since the pandemic's start. Significant barriers prevent minority communities from gaining proper access to quality health care. The United States Department of Health and Human Services estimates that only 14% of the United States population has proficient health literacy, with white and Asian Pacific Islander adults having higher averages in health literacy than Black, Hispanic, American Indian, Alaska Native, and multiracial adults. Many struggle to find, understand, and use the information and services required to make informed health-related decisions and actions for themselves and others. As we deliberate the budget during Minority Health Month, I want us to be mindful of how we process and support the vital health information and services provided to our diverse communities. We are blessed to have 3 organizations committed to improving health, literacy, education for our minority communities. Further, in our school system, we have health and wellness centers and linkages to learning programs that provide mental health support and wraparound preventative care to our students and their families. Last week, I went on a health and wellness tour to visit these resources at 2 high schools and 2 elementary schools. I thank my colleague, Vice President Andrew Friedson, for joining me and seeing these investments' tremendous impact on our most vulnerable communities. Finally, I want to recognize the significance of our county's Office of Racial Equity and Social Justice. This office's work is crucial to reducing health disparities, and we must support their continued role in improving healthcare decision-making. Now I would like to turn it over to our speakers, County Executive Mark Elrich, Dr. James Bridgers, Dr. Christopher Rogers, Jackie Williams, co-chair of the African American Health Program Executive Committee, Mariana Serrani, senior manager with the Latino Health Initiative, and Hina Mehta, vice chair of the Asian American Health Initiative Steering Committee. And I believe we have a representative from the Black Physicians Health Network joining us as well. County Executive.
So thank you very much for asking me to join you this afternoon in this proclamation. Um, National Minority Health Month is, it's an important month to recognize in Montgomery County. This is a county that is now majority minority, if that's even a proper word anymore. This has gone from a county that in 1970 was 95% white to a county that is 56% everybody else. And so it's a remarkable change in the county. But one of the things that hasn't changed is the persistence of health inequities in the county and in the nation. Montgomery County is not an outlier in still having equities persist in the county. And we see this in infant mortality. During COVID, we saw it all across the board. And it was one of the things that COVID made very clear to people, if they didn't already know it, was that the health disparities in the community are real, that the death rates among African and Hispanic groups were higher than other groups, and the number of people who got sick and infected was higher than other groups. And I think it helped focus some of the things we did during the pandemic. Mainly it was shifting the way we handled HHS and relying more on community groups to do the outreach and the work in the communities rather than having everything flow out of HHS. It was a good decision. And I think it's helped us move forward, but it's something we decided as a result of COVID that we're actually keeping in our budget. So you're going to continue to see the hubs in the budget, and you're going to continue to see a growing emphasis on what we can do with our community partners in terms of providing additional outreach into the minority communities. This work is going to remain important for a while. I'm optimistic. I know the governor's thinking about changes in the healthcare system in Maryland that would provide more resources to people in the minority communities. This could be a significant improvement over where we are today. And it's something that, we know needs to happen, and it has to happen statewide, not just in Montgomery County. We have, I think we know where folks are coming from, but, this operating budget has over $2.5 million carved out for the 3 health initiatives, has more money that will be there for the Black Physicians Network, which got, several $1 million last year when that not last year, I guess it was last year when it was stood up to do the work they had been started doing during COVID. So we want to make sure that those organizations continue to be funded. We have food relief continuing in this budget. We've got rent relief continuing in this budget. All these things focus on communities of color. They are the primary beneficiaries of much of this, and that has to do with they're also the primary folks in the county who have the lowest incomes. So the work we're going to do, and we've been doing with the council and all of the departments in the county, have been trying to focus on how we address inequities, and that's going to continue to be a focus of the work we do. So thank you for bringing our attention to this today. Thank you for giving me an opportunity, and all these other folks up here having an opportunity to talk about the work we're doing. Thank you.
Thank you, Councilmember Sayles, for your data-driven work in communities of color. Good afternoon, everyone. I am pleased to be here with you to acknowledge National Minority Health Month. This year's theme of better health through better understanding honors the diversity reflected across communities of color and the tailored responses required for successful engagement and community health improvements. DHS continues to embody this approach, and I am privileged to have the level of expertise we maintain in this county with Dr. Davis and Dr. Rogers leading our public health services. I also want to recognize Betty Lamb, who is the chief of our Office of Community Affairs, and her team for spearheading community-specific initiatives within the Department of Health and Human Services for many years. We are proud to have 3 indispensable, I will say that again, indispensable multicultural health programs that address health disparities, promote health and well-being in Montgomery County, and serve as trusted community ambassadors. For example, in our African American health program, we have our SMILE program, which means Start More Infants Living Equally Healthy. SMILE seeks to decrease the high rate of Black infant mortality and improve the likelihood of successful program and pregnancy outcomes. During the COVID pandemic, our Latino Health Initiative began implementing a community health worker certification program. With the certification, our health promotores can be employed in a medical setting or social service organizations, thus improving access to culturally appropriate services for our Latino community. The pandemic also highlighted the great work of our Asian American Health Initiative, who launched the Healthy Community Funds that funded micro-grant programs to increase social support services, behavioral health, and senior wellness in that community. To date, 10 organizations have been awarded micro-grants through this initiative. Lastly, we salute the contributions of Salud y Bienestar and our Black Physicians and Healthcare Network, two initiatives developed during the pandemic that continue to provide essential community support throughout the county. These initiatives represent what can occur when partnership and ingenuity are paired with data-driven and public health outcomes. And they personify this year's theme of better health through better understanding. And as I conclude, I'd like to remind my colleagues, all the colleagues at HHS, my colleagues at the council, the county executive, that we will get there together. And I mean that. And this includes the work that the county council continues to do to help us and work collaboratively with us, the HHS, to develop person-centered services with data-driven outcomes. Thank you, Councilmember Sayles, for allowing me just a brief moment to share HHS's way forward. Thank you.
Thank you. Good afternoon. I'm Dr. Keisha Davis, the County Health Officer. Thank you, Councilmember Sayles and the entire council for this opportunity to recognize National Minority Health Month. As a family physician, I have seen firsthand the disparities that exist within our communities. And while Montgomery County has become increasingly diverse, has some of the most diverse counties, most diverse cities in the country, and we are quite proud of that, we still see disparities that exist even within our ranks. And recognizing the importance of addressing those and continuing to minimize those is really important and part of the reason why I'm here. When we're trying to care for the whole person, it's necessary to understand that that person's unique circumstances, their background and culture are vital to ensuring that they receive the best care. And no matter the situation, our BIPOC persons, that's Black, Indigenous, and persons of color, and all individuals must be included when decisions are being made about policy and program changes that may have impacts on their health and well-being. We know that so much of what impacts a person's health exists outside of the exam room, and many of the decisions that this council makes on land use, on transportation, on education affect and impact our health. Welcoming discussions from a place of empathy and practicing cultural humility is imperative to ensuring that BIPOC persons and all residents thrive not only in Montgomery County and throughout the nation. Building on the theme of better health through better understanding, I call upon all of us to take this health observance as a call to action to ensure health education, services, and programs continue to meet the needs of Montgomery County residents. Thank you.
Good afternoon. My name is Dr. Christopher Rogers, and I am the Acting Chief of Public Health Services. I'd like to first thank County Executive Elrich, Council President Glass, Council Vice President Friedson, Councilmember Sayles, and the entire County Council for issuing this proclamation in recognition of National Minority Health Month, or shall I say National Multicultural Health Month, as my colleague Dr. Davis has been emphasizing and framing. Stating National Multicultural Health Month properly acknowledges the shifting landscape that people of color are the largest group of individuals in Montgomery County, and removes the connotation that people of color are socially insignificant, which ultimately influences where resources and efforts are directed. I'd also like to recognize the county's highly skilled and talented workforce, made up of persons of color representing the Hispanic or Latino, Black or African American, Asian American, Indian or Alaskan Native, Middle Eastern or North African, Native Hawaiian or specific Islander, or multicultural populations that all contribute to advancing health equity for county residents. I've had the fortunate opportunity to work in or contribute to identifying and addressing racial disparities in health and healthcare in nearly a dozen states across this country. No place have I seen a commitment to improving public health of its multicultural residents like Montgomery County. For me, National Multicultural Health Month is about raising awareness about the variety of upstream, midstream, and downstream factors, including perceptions of race, upbringing, family connections, community, medical care, and social determinants of health that impact the persons of color's health and how to address such factors. Even though Montgomery County is ranked as the healthiest county in Maryland, the upcoming Public Health Services Community Health Needs Assessment that will be publicly released later this spring will underscore work that we all must continue to do to address health disparities such as health literacy, access to care, and social determinants of health that affect persons of color. As Montgomery County government transitions into the next fiscal year, as acting chief of public health, I look forward to continuing to work with all of you, county departments, and community stakeholders to advance health equity for people of color living, working, worshiping, and playing in Montgomery County. Again, thank you for issuing this proclamation to recognize National Minority, rather Multicultural Health Month.
I think I got it. Hi, I'm Jacqueline Williams. I'm the co-chair of the African American Health Programs Executive Committee. But today I wanted to talk to you about the National Minority Health Month. I have a very special place in the launch of the National Minority Health Month. I worked with the Office of Minority Health, OASH, federal office, back in the day when we were starting this effort. Our staff met with our Office of Minority Health staff, with our Office of Minority Health Resource Center staff. We got together, we brainstormed, hey, what can we do to help our minority communities? And we came up with, 10 days later, to launch the National Minority Health Month event. Way back then. Fast forward, I moved on to the AHP Executive Committee, and would you believe it? They wanted to have a community day. And guess what? Community day happened to be at the same time Minority Health Month started. So we used to have Community Day in April every year, except now the pandemic has kind of changed our schedule a little bit. But by the way, our new Community Day is going to be May the 30th. May the 20th at Germantown campus of Montgomery College. It's free. Going to have a lot of stuff going on, face painting, STEM activities, a safety event, coat trailer, all kinds, gardening, you name it. But I digress. I just wanted to say that I am very thankful that Montgomery County is recognizing the National Minority Health Month, something that it's kind of my baby in a way, because I was there as part of the initial planning. And thank you so much for the proclamation.
Good afternoon. My name is Mariana Sarrani, and I'm the Senior Manager for the Latino Health Initiative. And it's a pleasure to be here this afternoon. We would like to express our gratitude to Councilmember Sayles in honor of today's proclamation of National Minority Health Month. So the Latino Health Initiative mission is to improve the health and quality of life of the Latinos living in Montgomery County. To this end, we develop and implement programs to connect Latinos with cultural and linguistically competent health and human services. So in this year, National Minority Health Month, Better Health Through Better Understanding, calls all of us to recommit our efforts to improve the health outcomes of racial and ethnic minority groups by providing cultural and linguistically competent healthcare services and information. We believe these resources will empower residents to make improved health choices for themselves and their families. With the support of the County Council, the County Executive, we will continue our dedication to advance health equity and increase healthcare access to the most vulnerable residents of the county. Thank you.
Hello, I'm Hina Mehta, and I am the Vice Chair for the Steering Committee for Asian American Health Initiative. Steering Committee is a group of individual advisors who came together from different Asian American community because we are so diverse. There are 14 ethnicity. So we are the representative of the community working with different community-based organizations, and we advise and assist the staff of AAHI. With this, I first of all thank you, council member, for recognizing this, need for the minority health and, organizing this event. We are really thankful for this opportunity. And I would like to say one thing is that pandemic has really brought to the full display the health disparity and inequities that exist in the minority community. And throughout these 2 years, I cannot just, as a community leader, I can't just, stop reflecting back how much Montgomery County has done for us. So I want to take this moment to thank the county and the government for all the tremendous effort they have put towards the need for the minority health. But having said that, without these programs, AAHI would not have been able to deliver all the programs they have been able to deliver. Especially, I would like to give a note for the AAHI staff, the work they have done to deliver the community health funds and the microgrants. That has reached our community in a very, very different ways. We were able to deliver the safety net clinics, behavioral health, senior living, and we have to understand one thing: when we talk about Asian American, there is no one size fits all. We have to cater individual community in a culturally responsive manner. So without this support, we will not be able to deliver these things. So this is a month where we really celebrate these achievements. But with these achievements, we also want to have a note to the county that we would appreciate that county continues to invest in this effort so that as in organizations, as a minority health group, all of us can continue serving our community. So once again, thank you for this proclamation and opportunity.
Good afternoon. My name is Crystal Holland, and I am with the National Center for Children and Families and the director of the Black Physicians in Healthcare Network. And I would like to also thank Councilmember Sayles and all of the council for this proclamation today. As we use this month as a platform to bring special attention to the health disparities that continue to affect people from racial and ethnic minority groups and encourage action through health education and early detection, this agenda requires ongoing focus if we seek to improve the health outcomes of minority residents in this county. The Black Physicians in Healthcare Network is excited about our role in being a part of the solution to improving access and minimizing the health disparities that exist among the Black residents in this county. A recent study on Black representation in the primary care physician network suggests that having greater representation levels is associated with lower all-cause mortality rates among Black residents. However, in the United States, only 5% of physicians are Black. The Black Physicians in Healthcare Network connects residents to our network of 51 culturally specific Black healthcare professionals who are committed to providing culturally tailored quality care to the Black residents in this county and committed to minority health. Blacks have a long-standing history of mistreatment and exploitation by the medical system, which has led to mistrust. And although decades have passed since these experiments, the Black community has not yet healed the wounds produced by the medical system. So raising awareness on this critical issue of importance, it is important for advancing health equity and minimizing barriers for minorities to access health care. This will all help residents of this county to live our healthiest lives possible and live and build communities that thrive. Thank you.
All right, and now I will join the county executive in reading the proclamation.
Whereas National Minority Health Month is a necessary time to raise awareness about the health inequities that disproportionately impact communities of color, and
Whereas its origins date back to 1915 when civil rights pioneer Booker T. Washington established Negro Health Week to help educate Black communities about proper health practices, and
whereas this year's theme, Better Health Through Better Understanding, highlights the importance of having effective healthcare services, resources, and information that reflect the diversity of our community, and
whereas the United States Department of Health and Human Services estimates that only 14% of the U.S. population has proficient health literacy, with white and Asian Pacific Islander adults having higher averages in health literacy than Black, Hispanic, American Indian, Alaska Native, and multiracial adults, and
whereas these lower averages are the result of people struggling to find, understand, and utilize the information and practices required to make informed health-related decisions for themselves and others, and
whereas Montgomery County's 3 minority health programs, the African American Health Program, the Latino Health Initiative, and the Asian American Health Initiative, provide culturally and linguistically appropriate services to improve health outcomes and alleviate health disparities, and
whereas Montgomery County can address disparities in health outcomes by improving the capacity and number of providers in underserved communities, addressing the social determinants that contribute to health disparities, continuing investments in school-based health and wellness centers, expanding the oversight capabilities of the Office of Racial Equity and Social Justice, and continuing to partner with and increase funding for our minority health programs.
now therefore be it resolved that the County Council of Montgomery County, Maryland hereby recognizes Minority Health Month as a critical month to further progress on reducing global and local health disparities for minorities, presented on this 18th day of April in the year 2023 with County Executive Mark Elrich and myself, Councilmember Sayles. Thank you.